So question 9 asks us um, to pick whether duration of gestation or the intrauterine growth rate has more of effect when discussing the birth weight of babies born at high altitudes. So, um, as a class, we looked at some data that that showed us that data for a bunch of babies born in Colorado at different altitudes. And from that data, it showed us that um, most of these babies, the higher percent, around like 20 or 80 to 90% of these babies were going through full term pregnancies, or at least like 39 to 39 and a half week pregnancies, and they were all pretty similar. In far as term of gestation. The one thing that was the couple things that were different was the elevation at which these babies were uh, born and gestated at, um, as well as their birth rate or birth weight, which we saw as elevation increased, birth weight for these babies decreased, which tells us that the intrauterine growth rate is the um, most responsible for the size of the baby. And this has to do a lot with the uteroplacental flow of blood. Um, at higher elevations, the flow of blood to the uterus and to the placenta is restricted, and the placenta is mainly responsible for providing nutrients and oxygen to the baby. And we also have seen that oxygen saturation in the blood of in the arteries of the mothers of these babies is um, pretty normal. It's relatively stabilized, unchanged, at a healthy place for them to continue life. But we do see that the uteroplacental blood flow is reduced, so the baby is not getting as much oxygen as it could be at lower elevations, and that is the primary cause for decreased birth weight in babies born at high altitudes.